Next up, we have Dr. Justin Q. Dr. Heinze is an assistant professor in the Department of Health Behavior and Health Education at the University of Michigan School of Public Health. He also co-directs the National Center for School Safety, which is one of the affiliate centers here at the University of Michigan with our Injury Prevention Center. And he serves here within the Injury Prevention Center as the evaluation lead for our Outreach and Translation Core. By training, he's an educational psychologist. He has a concentration in measurement, evaluation, and statistics, and he's evaluated through both our center as well as his broader work, many projects, including SAMHSA's Drug-Free Communities Program and the Michigan Core State Violence and Injury Prevention Program, which is funded through the CDC and our state health department. Dr. Heinze's research interests include developmental transitions, social exclusion and ostracism, school safety, and longitudinal data methodology. As a reminder, Dr. Heinze's talk is pre-recorded, but he will join me for a live Q&A following his talk, so please type any questions that you have regarding his presentation or his work into the chat. Welcome, Dr. Heinze.
Hello, everyone, and thank you so much for having me. My name is Justin Heinze, and I'm an assistant professor in health behavior and health education at the University of Michigan School of Public Health. And today I'm coming to talk to you about interdisciplinarity and how it's a strength in injury research. So you might wonder why an educational psychologist is focused on injury prevention. And for me, it was a little disconnect before I got into this field. An educational psychologist tends to focus on applying psychological principles to the science of teaching and learning. So we teach teachers how to teach. And there wasn't an explicit connection for me in what I do in the injury prevention world. But I want to tell you a little bit about my story and how I feel my field can connect to injury research. And then you might see how your own fields, even if they're not from standard fields like medicine or public health, can also connect to injury research and how you can become engaged and remain involved and build this field. So one of the most, I think, salient examples of how education overlaps with injury is this idea of firearm violence. And when you think about firearm violence, chances are it calls to mind images of mass shootings that have happened over the last 5 or 10 years. And they are very salient events. There's a lot of media coverage, and they tend to prompt a lot of response. So people want to find out why they happened and what we can do about them. But people often overlook that mass shootings are the tip. They're the tip of a much larger firearm injury burden within schools. So even though they are very noticeable events, there are often other kinds of firearm violence that happens within schools, like unintentional shootings, like self-directed or suicide that might happen among students, and then other forms of shootings that are much more common but receive much less attention. So we might be missing an opportunity if we focus all of our attention and effort on that tip of the iceberg by ignoring some of the other more common forms of firearm violence within schools. And then to add to that, firearm violence as a whole is actually just the tip of an iceberg when we think about school violence more broadly in terms of all the other different ways that students can experience violence. So for example, interpersonal fights that might happen in the hallway or on the school grounds, bullying and victimization, which could happen within school settings or could happen even online, and then often an unnoticed but yet very common and still very important internalizing behaviors that can have both mental and physical consequences. So again, if we focus our effort and attention on some of those most salient forms of violence, we could be missing some prevention opportunities that are much more common across a variety of different school settings. And so as an educational psychologist who's interested in injury prevention, I'm tempted to look at the available evidence and try to make recommendations for what is most appropriate, what is going to give us the most bang for our buck in terms of addressing the true injury burden that our students are facing. And so sometimes that can mean things like mental health programming or socio-emotional learning that's not directly related to increasing school safety through target hardening measures that might, for example, be related to trying to prevent firearm violence. And there's a good reason for that. When it comes to some of those severe forms of violence, lots of times folks have ideas, but those ideas are untested or don't have enough evidence base to suggest that they're truly effective in terms of preventing violence. So here is just an article from some colleagues and also affiliates of the Injury Center that looks at, for example, arming school teachers. So after the Parkland shooting in 2018, there was this big push that if we just gave more teachers firearms, that would deter any sort of individual who might want to try to come in and commit a mass shooting event. But there's really no evidence to suggest that this would be an effective method. And that's one example, but there are a variety of things in my field of school safety that could be, that could, in theory, affect firearm violence or other sorts of injury, but that don't have a lot of evidence base. And so to be able to recognize which of these strategies have evidence, or if they don't, to help to develop that evidence is an important part of the work that I'm trying to do. But why am I trying to do this? Why, again, am I not focused on teaching teachers to teach? And it comes from some qualitative work that we did with a school that was very close to Sandy Hook Elementary in Connecticut. And when we spoke to the principal, she gave us this quote that I thought was very meaningful. She said, "Since the shooting, we've been learning how to hide. That is where this school and their teachers and their students are investing their time and energy. They're learning about trying to keep themselves safe." So for me, that's detracting away from what school is really supposed to be all about. It's that reading, writing, and arithmetic. And we're not seeing that when we're focusing our energies on keeping students safe. So what we're trying to do is develop interventions that will allow us to take that injury burden off of students and teachers and administrators, help to improve school climates, help to improve safety, that can then refocus their efforts and attentions to those important educational topics. So some examples of some of the work that I'm doing in this area. We have a variety of studies that are in school settings, and we are using different approaches, so different experimental designs with different foci that allow us to assess school safety very broadly. So in one example, working with students in Flint, Michigan, we were really trying to understand what is the etiology of school violence. So we used a survey to try to figure out, what does school violence look like for 6th, 7th, and 8th graders? We wanted to understand from their experience, what did their own victimization look like? What did other victimization look like that they observed? And how did that affect their transition from middle school to high school? So we were looking at this developmental period where students were making this important educational transition and whether or not violence had some sort of influence there. And we followed up those surveys with longitudinal qualitative data collection so that we were speaking to the same students over time to really understand what their experience was like. So we were using a mixed method approach, which gives us a little bit more substrate and substance to the survey, which is often ignored in many studies that are just looking at either a panel of students or are just a single administration. We're also working with the Sandy Hook Promise Foundation to test an intervention that tries to improve school climate and the ability of students to recognize signs and symptoms of violence. So we use a conceptual model like this to not only look at an intervention, but also to really understand what are some of the mediating and moderating pathways that need to happen, that need to fall into place before we can achieve some of those long-term outcomes. So thinking more deeply about what is the true mechanism by which an intervention, for example, could affect our firearm or injury-related outcomes. In another study that we're doing in Michigan, we're using some available and existing interventions. So 3 evidence-informed approaches: crime prevention through environmental design, mental health first aid, and restorative justice practices. These are all different areas of intervention that have some evidence base that they're going to be an effective means to reduce violence and improve mental health. We're taking those evidence-informed approaches, bringing them together to see if a kitchen sink type of approach can again have an effect on some intervening variables like school climate, which then we believe could affect mental health and then ultimately violence. So In the first example, we're taking we're generating new evidence. The second example, we're testing an intervention. And the third, we're taking established interventions and seeing if they work in new contexts or if they work together. And then finally, you can think about some other approaches within injury, like Haddon's matrix here, if you're familiar, where you can think very critically about when violence is happening, and think about the upstream influences and the downstream influences, and where are the different points of intervention. Who is the target? Who is the host? So who is the victim of the event? Who is the perpetrator of the event? What were some of the features of the context that enabled that to happen? So I use a Haddon's matrix, for example, to think holistically about what violence looks like within schools. And then when we are deciding on how we can approach this, this holistic approach can be a guide for us. And ultimately, this has resulted in me, has culminated in the National Center for School Safety, where we are now working with schools and grantees across the country in these 6 or 7 areas of school safety, where we're trying to promote some evidence-based and evidence-informed ideas and how these different schools can implement these ideas to improve their school safety strategies. Because not every school safety strategy is going to be the same for every single school. But our center works across these disciplines, trying to bring in all these different approaches, and ideally helps to provide evidence to support their use in other contexts as well. So that's my time. I hope this was informative for you to see how someone from outside of the injury prevention world has made this a critical part of the work that I'm doing, but also connecting to a new field, bringing insights and approaches from psychology and from education to see how these ideas from injury can apply into that particular context. And I think if you think a little bit about your own fields, you might see some connections of your own and see how everyone can be in injury science. Thank you so much for having me today. I really appreciate your time and attention.
Thank you, Dr. Heinze. That was a very interesting talk. Please, as a reminder to folks, they can submit questions through the Q&A function on the website. The first question I have for you, Justin, is, as you mentioned in your talk, transition to high school is really a critical phase in people's lives, especially young people's lives. And I wonder if you could share a little bit about, from your data, about how perceptions of school safety might impact that transition.
That's an interesting question, and it's one that we hear a variety of perspectives. But what surprised us when we spoke to transitioning students, they knew context, or at least they believed that they knew the context that they were getting into. So they understood what it meant to make the transition when we talked to them before they ever made this transition. They were often surprised at the beginning of their transition to high school about how well things were working. We call it a honeymoon period. It wasn't until you got to the end of that first year where students started to recognize some of the, you might call it less overt violence that was happening in the schools. They started to recognize places that might not be safe. They started to recognize whether or not they had support systems available to themselves. So it was interesting to watch these changes in the way that students kind of thought about their school environments. At first, it was with more positivity, and they were excited to be there. And they thought, this isn't as bad as I expected it to be. But then as time went on, they started to struggle a little bit more. So one of the things that we think about in terms of developing an intervention is whether you need to have sustained efforts, not just at the beginning of the transition period, but to something that's going to last throughout their whole first year and perhaps even into subsequent years as well. So that was one big lesson that we learned from this data.
That's really interesting to think about how, it's not just that initial transition, but really kind of interventions throughout. I'm curious what implications you think some of this research might have for school policies. I mean, we've seen a lot of school safety policies coming up around the country in different formats, and I'm curious what you think your data shows around how this could impact school safety policies.
Certainly one of the findings that we believe is emerging is that there are a lot of school safety strategies that either, ostensibly make sense or intuitively could be effective, but there's really not a lot of evidence to support them. And that includes some high profile things like active school shooter drills. Anonymous reporting systems are required in something like 25 or 26 states, neither of which has a whole lot of evidence regarding their efficacy. That doesn't necessarily mean we should stop doing them, but what it does mean, in my opinion, is that we need to focus resources to test whether or not these have implications for students themselves, whether or not they are effective in terms of their outcomes, but then also the implementation themselves. So what does it mean to have some of these school safety strategies implemented in a variety of contexts? Because we also understand that one size fits all models in terms of school safety rarely apply. There's so much diversity in our school populations across the country that there does need to be some tailoring of different school safety strategies. And so we advocate for comprehensive school safety plans that include some of these elements that you think are going to be necessary, that also can draw on that evidence-based or evidence-informed practices, but then allow these schools some flexibility to tailor them to their populations. But then again, thinking about those strategies that are out there that don't have that evidence base yet, it's not suggesting that we shouldn't try them, we shouldn't test them, but we do need to develop some of that data. So focusing some efforts on testing and implementation of some school safety strategies is necessary.
I think that's a really important point, that that all these policies are starting to crop up, and that we not only need to test the efficacy of them, but also what the unintended consequences of them be. And I think that's where the type of research that you're doing can really, really benefit the future of kind of school safety policies. And so I want to wrap up here so that we move on to our next speaker, but I really want to thank Dr. Heinze for his presentation and the Q&A and all of his great work that he's doing with our Injury Prevention Center, as well as through the School Safety Center, which you can get both through the School of Public Health website and through a link on our website. So thank you again, Justin.